Hi, my name is Precshard Williams. I am a Prevention and Sexual Health Program Coordinator at Metro Inclusive Health here in St. Petersburg, Florida. I want to talk with you all a little bit about the different tools that we have in our toolbox to combat HIV and HIV stigma. First, number one is testing. We can't really do much without knowing our status. It is so important that we do know what our HIV status is, and how we know that is by getting tested for HIV. There is no other way for a person to know whether they're living with HIV or not if they not get tested. HIV testing can be done simply within 20 minutes, and sometimes even shorter. There are tests available now that you can get your results within 1 minute. We do testing out in the community via mobile units, and we also do testing in our office. In an HIV testing session, an individual is able to basically reflect on experiences and also learn ways to lessen their risk for HIV. Another tool in our toolkit would be condoms. I know condoms have become very taboo, but they still do work. A person can use condoms that are specific to their sexual engagement, but there are plenty of condoms out there. My biggest suggestion, or my greatest suggestion, would be to practice. Practice makes perfect. Another option to combat HIV stigma and also HIV is viral suppression. Viral suppression in U equals U. When a person is diagnosed with HIV, the best way to keep them safe as well as others is for them to get on treatment. HIV treatment has evolved so much nowadays to where people are reaching viral suppression in as little as a month. So, knowing that a person is living with HIV and knowing that they can take their treatment every day at the same time, which will bring down the amount of the virus in their blood and also make it inevitable, or make it impossible, I should say, for them to pass HIV on to their partners. PrEP, Preexposure Prophylaxis, is a 1-a-day medication that a person who is negative for HIV can take once a day to protect them from HIV. So by taking a pill each day, there will be a protective barrier formed around their immune system and their CD4 cells. HIV attacks the CD4 cells and transforms those cells into HIV cells, and that is how a person their viral load continues to grow. But for people who are negative, if they're able to take this medication prior to being exposed to HIV, the treatment can actually prevent them from getting the virus. So there are a few tools out there, and we want to make sure that everybody is aware and knows how to utilize those tools to help combat HIV. The last tool that we want to make sure everybody knows, which is a very important tool, is the power of a conversation. Having open dialogue and conversation around sexual health can go a very long way. Be sure that your conversations are inclusive. Be sure that you're aware of who you're talking to and they're aware of who they're talking to. Be aware of how much you know and how much they know. And lastly, if you need any other information beyond this, know that we, Metro Inclusive Health, are right here in St. Petersburg, Florida, 3251 3rd Avenue North, 33713.